For most people, the reason that they're going to end up having a cesarean section is because they've been in labor and for whatever reason the baby's either too big or the mom's pelvis is too small and the baby won't come out. And that's not generally an emergent process. It's generally something that evolves over time. You watch the woman labor and the baby's head's not descending, baby's not delivering, and so you make a decision that it's better that the baby be delivered by cesarean section. So there's not a ton of rushing around. That's not while it's not a scheduled cesarean section, it's not unplanned. It's something we're well prepared for. In certain cases, we know before the woman even goes into labor that we don't want her to labor. There's a variety of reasons. One very common reason might be that the baby's in a position that doesn't deliver easily. For example, a baby that is in the breech position, presenting butt first instead of head first. Well, in that case, the vast majority of people are going to have a cesarean section, and that might be scheduled. So you would know going into the hospital that you're going to have a cesarean section that morning. The anesthetic actually diffuses from the epidural space into the area around the spinal cord, and it really doesn't circulate in any significant levels in the mom's blood. And if it doesn't circulate in the mom's blood, it doesn't transfer across the placenta and get on board the baby. The other thing is that if there's not an epidural on board when the mom needs to undergo a cesarean section, usually a spinal anesthetic is needed. And a spinal anesthetic is actually even easier for the anesthetist to place than an epidural. Perfectly safe, and it's quick. It does involve the mom sitting up. Now, usually she's been at this point transferred to the operating room. So she sits up on the operating table, a little bit of medication is injected into the back, and then she's laid down, and the epidural, or the spinal anesthetic takes effect and renders the area that's going to be operated numb. Anytime we perform a cesarean section, we're performing it because we think it's for the benefit of the baby, the mother, or both. And we're not looking to do any more invasive therapy for anyone than is absolutely necessary. The fact of the matter is that a cesarean section is a very safe procedure. Lots of cesarean sections are done. The complication rates are fairly low. Sometimes babies that are born by cesarean section are at some increased risks of developing tachypnea of the newborn. That is, some difficulty breathing. It's felt that if a baby has been in labor with mom beforehand, that baby gets all the advantages of having been in labor. Sometimes that means that the lungs have had an opportunity to change in a certain way that it reduces the chances of the baby having a problem with breathing afterwards. If someone undergoes an elective cesarean section, that is, they just opt to have a C-section, or maybe a scheduled cesarean section, there might be a small increased risk of the baby having some difficulty breathing after delivery. Usually that resolves within 24 hours. In a true emergency cesarean section, it has to be performed very quickly. From the time at which it's decided to perform the C-section to the time at which we actually make an incision should be less than 15 or 20 minutes. And in that situation, we're going to be hurrying back to the operating room, and we may not have time to dose an epidural or even giving a spinal anesthetic. In that situation, the mother may need to go to sleep and have general anesthesia. Recovery from a cesarean section is usually a couple of days in the hospital, and it takes a little bit longer to recover outside the hospital just because the incision can be sore. But most moms are up and about taking care of their baby and attending to the rest of their family within a week or so. So the pendulum has swung back and forth on this issue of whether or not someone can deliver vaginally after a cesarean section. Right now, the pendulum is in the camp of most people end up having another cesarean section and have cesarean sections for all their children. Though a motivated patient could have a vaginal delivery after a cesarean section, depending on what the indications for the first cesarean section were. The best case scenario is for a woman who had a cesarean section the first time because maybe the baby was breech. But at the second time, the baby's not breech, she might be a good candidate to try to deliver vaginally.